So let's continue with the second lesson, your lesson 11 class, hepatitis viruses. So in medical technology class, there are five major types of hepatitis viruses, and they are classified according to their family and their route of transmission. So we have your hepatitis A. Hepatitis A class belongs to the Picorna viridae family. Your hepatitis B belongs to the Hepatnaviridae family. Your hepatitis C belongs to the Flaviviridae family. Your hepatitis E formerly belongs to the Caliciviridae family. And your hepatitis G, which would belong to the Flaviviridae family. So they have their own families of viruses. Now there's your route of transmission. Kapag, pakitandaan lang to class, if it's related to the oral fecal route, it's your hepatitis A and E. Kapag, kapag sexual contact, blood transfusion, and placental transplant, or yung tinatawag nilang parental, just remember hepatitis B, C, and G. So ulitin ko class, if it's oral fecal route, it's your hepatitis A and E. So pag sinabi mong oral fecal route, you would acquire it by ingesting food or water contaminated with the feces with the virus. Kapag BCG, hepatitis B, C, and G, you could acquire it via sexual contact, blood transfusion, or from the mother through placental transplant. Now, let's first discuss yung hepatitis B virus. The hepatitis B virus class is one of the most important viruses known to cause liver CA. Now, hepatitis B virus class, please take note, has a size of 42 to 47 nanometer. It's also known as your Dane particle. An unusual virus because it would require an RNA intermediate to replicate. A viral encoded reverse transcriptase is needed for replication. So it has an incubation class of 50 to 180 days, and it has different phases. So the first phase is your acute phase. So your acute phase class is like your incubation period. This is a phase that would last for up to 100 days after infection and is detected by HBS antigen. Then we have your window phase or your period of recovery, detected by anti-HBC. If the infection is primary, it is detected by IgM anti-HBC. Naalala nyo class sa immunosero nyo, di ba? If it's a primary infection, the antibody associated with this would be your IgM. So primary infections would usually be at the beginning, kakastart lang. Pero kapag naman mga secondary or yung tinatawag nilang chronic, yung matagal na, it's your IgG. So if the infection is primary, it's IgM anti-HBC. Kapag secondary na, it's IgG anti-HBC. Now, let's talk about the markers present in active or chronic hepatitis B infection. So, yung pinaka-common marker is your hepatitis B hepatitis B surface antigen. Now, HBsAg is also known as your Australian antigen. This is the first marker, the best indicator for early infection. Can indicate acute or chronic infection. So kapag nag-positive ka sa hepatitis class, you are newly infected, this would be the first marker that would be increased. Then we have your HBC antigen. Yung letter C dyan, please take note, would stand for core. This is your hepatitis B core antigen. This is found within the core of your intact virus. Not detectable class in serum because it is found inside infected liver tissues or inside liver cells or your hepatocytes. So hindi dinedetect class sa serum yung HBCA gene nyo because it's not found in the serum. It's found in the liver tissue or the liver cell. Then we have your HBE antigen. Yung E dyan would stand for envelope. It would indicate chronic hepatitis. So kapag nag-positive ka dyan class, you already have an advanced type of hepatitis infection. A reliable marker for high degree infectivity. Now let's talk about the different antibodies. So meron siyang tatlong antigen class, HBsAg, HBcAg, and HBeAg. Now meron din siyang tatlong antibody. We have the anti-HBc antibody or the anti-hepatitis B core antibody. This is the first antibody to appear accompanied by elevated enzyme levels, specifically your ALT, your GGT, and even your AST. It's usually found in asymptomatic carriers, marker present during the window period. Then we have your anti-HBe antibody associated with good prognosis. So pag good prognosis class, there's a high chance that your patient will recover. Serological evidence found in the convalescent phase. Then we have your anti-HBs antibody, which may indicate recovery or immunity after hepatitis V vaccination. May persist throughout life. So ito yung interpretation class ng mga assay result nyo. Now I want you to take note class, kapag ikaw, 'di ba, as coming interns class, you're required to have a vaccine for hepatitis B. So kapag nagpa-test ka ng mga assay mo after vaccination, ito yung magiging result mo. So after vaccination, you had your blood tested for hepatitis B. These are the supposed result. Sa HBsAg class, dapat negative ka. Sa anti-HBC, negative ka din. But sa anti-HBs, you are positive. That is why class, si anti-HBs nyo, this is the marker that would identify a person as being immunized against HBV. To simplify class, kung gusto mong malaman na effective sa'yo yung vaccine mo, you need to become positive sa anti-HBs. Then kapag naman meron kang early acute HBV infection, pag meron kang early acute hepatitis B infection, what you would be positive to is HBsAg only. HBsAg only. So in early acute hepatitis B virus infection, only your surface antigen ka positive. Then if you have an infection that would either be acute or chronic, differentiate with IgM, anti-HBC, determine level of replicative activity with HBAg or HBV DNA. So you would be positive for HBsAg and anti-HBC. Then you could be positive or negative naman for anti-HBs. Then if you have a previous hepatitis B virus infection and immunity to hepatitis B, you would be positive for anti-HBs and anti-HBC. So para mas maintindihan nyo klasa, if you want to identify if you were only vaccinated, kapag vaccinated ka lang, wala kang previous infection na, the only test that you would be positive is anti-HBs. Pero kapag nakapag-recover ka na, meron kang previous hepatitis B infection, you would be positive for both anti-HBS, and anti-HBC. Then possibilities with the remote pass low level HBV carrier window between the disappearance of HBs AG and appearance of anti-HBs. So kapag daw carrier ka class or carrier ka or nasa window phase ka, ganito yung magiging result mo. Negative ka sa HBs AG, negative ka sa anti-HBs, pero positive ka sa anti-HBC. So this would occur class if you are a low level carrier or you are in the window phase. This would also occur class if you have false positive or non-specific reaction. Then kapag naman never infected, you were never infected with HBV. So meron ka lang nasakit sa liver. Meron kang cirrhosis, meron kang uh, liver disease or liver cancer. You would be negative for all markers. So do memorize this assay results class and their interpretation. Now, what are the particles reactive with anti-HBs antibody? So we have your Dane particle. So Dane particle is basically your intact hepatitis B virus infection. Then we have your spherical. This is a non-infectious without the viral genome to detect bound antigen. Then we have your tubular particle, which is non-infectious. So markers for early recovery without immunity. So that would be your anti-HBC antibody and anti-HBE antibody. Markers naman class for early recovery with immunity. We have your anti-HBC antibody, anti-HBE antibody, and anti-HBS antibody. Other markers class would include anti-HBC IgM, recent acute infection, present for 5 months, appears in the window phase. Then we have your total antibody to hepatitis B core antigen, positive in acute infectious stages, indicates current or past infection but not immunity due to hepatitis B virus vaccine. Then yung vaccine nyo class is made by a recombinant strain of the yeast Saccharomyces cerevisiae. Saccharomyces cerevisiae class is your common baker's yeast. Now, what are the diseases caused by your hepatitis B? So we have your acute hepatitis, fulminant hepatitis, which would affect the entire liver, chronic persistent hepatitis, which does not progress. So there are markers for co-infection with hepatitis delta virus. So kapag meron kang infection ng HBV, meron ka ding hepatitis delta virus. So you would be positive for HBsAg, anti-HDV antibody, IgM anti-HBC antibody. Kapag meron ka namang super infection with hepatitis delta virus, you would have HBsAg, anti-HDV antibody. Then complication for viral hepatitis would include primary hepatocellular carcinoma. Other markers class would include IgM anti-HBC antibody for new infection and IgG HBC antibody for an old infection. Now let's go to your hepatitis virus A. So hepatitis virus A class is known also as your enterovirus 72. This is a naked. So when you say naked, wala siyang envelope, icosahedral capsid that is single-stranded. Has an incubation period of 15 to 40 days. Can be asymptomatic or symptomatic. Jaundice could be present. Hepatitis A virus capsid class is antigenic, meaning it would produce anti-have antibody that is either IgM or IgG. Serological test class would include heme agglutination, complement fixation tests, ELISA, RIA, and competitive immunoassay. Markers class specifically is your IgM anti-have antibody. So this would indicate acute infection. Appears 4 to 5 weeks after exposure. Disappears 3 to 6 months and is replaced by IgG anti-have antibody. IgG anti-have antibody signifies convalescent period. Sa hepatitis A virus class, di ba this is acquired via oral fecal route. Now, dito sa Pilipinas class, if you're the type of individual that likes to eat street foods, kunwari class, yung sauce na kinakainan nyo is infected with fecal material containing hepatitis A virus. So what happens is that yung person A, si person A, bibili siya ng street food. So kunwari yung street food na binili niya is fishball or squid ball. Sasawsaw niya dun sa sauce, sasawsaw niya dun sa sauce, kakagat siya, makukuha niya yung sauce sa bibig niya. Ngayon, yung saliva niya would be infected. So, ma-acquire niya yung virus. Another scenario class, let's say naman, this time yung sauce is clean, malinis. Pero si person A nyo, positive naman siya sa hepatitis A virus. So kung bumili siya ng fishball, bumili siya ng street food, sinawsaw niya dun sa sauce. Ngayon, yung laway niya nandun sa stick. Ang ginawa niya, sinawsaw niya ulit yung stick niya, pagkakagat niya. Now, this would cause the sauce to be infected. So, may particles na ng hepatitis A virus yung sauce. Kaya si person B, na kapag sumausaw naman dun sa sauce, would become infected. That is why, class, whenever you would buy street food, kakain kayo ng fishball, kakain kayo ng squid ball, ideal talaga na kumuha kayo ng plastic cup. Kuha kayo ng plastic cup, dun nyo ilagay yung sauce so that sa'yo lang yung sauce, hindi ka makaka-acquire ng sakit or hindi ka makakapag-spread ng sakit. Then we have your hepatitis C virus. So this has RNA with lipid envelope. It belongs to the genus Hepasivirus. Causes non-A and non-B hepatitis. It has no available vaccine. Incubation period is 2 to 25 weeks. It's known to cause chronic hepatitis resulting in liver cirrhosis. So between hepatitis B class and C, si C nyo class has a higher mortality. Mas deadly siya. Serological markers are not fully developed, false negative in some patients. Lab diagnosis is elevated liver enzyme, detection by ELISA and Western blot, detected also by nucleic acid amplification. Virus cannot be grown in cell culture. Then we have your hepatitis D virus. So it replicates with the help of hepatitis B virus. So kailangan, class, for your hepatitis D virus to develop inside the person needs to become infected first with hepatitis B. It has a helical nucleocapsid which uses envelope of hepatitis B surface antigen. Markers for co-infection with hepatitis delta virus would include HBsAg, anti-HDV antibody, IgM anti-HBC antibody. So ito yung mga assay result. Kapag meron kang infection with hepatitis delta virus, you would be positive for anti-HDV and hepatitis B surface antigen. Kapag meron ka namang both hepatitis B and hepatitis D virus infection, or you have a co-infection, positive ka dito. Positive ka sa anti-HDV, positive ka sa anti-HBC IgM. Kapag namang meron kang super infection of chronic hepatitis B virus infection which with HDV, you would be positive for anti-HDV plus anti-HBC or negative ka naman sa anti-HBC IgM. Then we have your hepatitis E virus. So it has RNA. It has a size of 32 to 34 nanometers. Resembles hepatitis A virus. Pregnant women with hepatitis E virus may develop fulminant liver failure and even death. Serological tests would include Western blot, PCR, and electron microscopy. So this is the summary class of the entire hepatitis A to E and their different markers and components. So hindi ko na siya i-discuss. Kindly memorize this class. This will come out in your coming quiz. So here are the references of your hepatitis virus. Thank you.